Hello and welcome to a very important Facebook Live. We are so excited to be joined by two individuals that I consider my heroes, good friends, mentors. Welcome to the Alliance for Eating Disorders Awareness Facebook Live on the cost of eating disorders. I am thrilled to be joined with the ever fabulous Dr. Bryn Austin and the amazing Cherie Monarch. We are here to talk about a groundbreaking report that literally just came out a few weeks ago that, in my opinion, is going to shift the conversation, hopefully make a tremendous impact. And as we'll talk about further in our talk today, hopefully will be the first of many steps in just doing better, creating more impact, and making more of a difference. So before we get started, we have so many questions, so many things that we want to address. I wanted to just introduce the two fabulous humans that are with me. First and foremost, it's a true honor. Dr. Bryn Austin is an award-winning researcher. She's a teacher and a mentor. She is a professor in social and behavioral sciences at the Harvard T.H. Chan School of Public Health. She is a professor of pediatrics at the Harvard Medical School and at Boston's Children's Hospital. She directs STRIPED, which is the Strategic Training Initiative for the Prevention of Eating Disorders, a public health incubator based at the Harvard Chan School and Boston Children's Hospital. Dr. Austin is the immediate past president of both the Eating Disorders Coalition and the Academy for Eating Disorders. Welcome, Bryn. Thank you so much for being here today.
Thank you, Johanna. It's an honor.
Fantastic. And then Cherie Monarch is a mom, a wife, a friend, a grandmother, and a fierce advocate for our eating disorder community. Cherie sits on the board of the Alliance and is the chair of the Alliance's FACED committee, which is our Family Action Committee for Eating Disorders, Instilling Truths. She is very active within our eating disorder committee and has been involved in many, many national advocacy events. She is also the founder of the Eating Disorder Family Support Networks. There are many different groups within that, including the very large Mom to Mom group. Cherie was awarded the National Mom Making a Difference Award in 2017 for all of her work with eating disorders, and she works day in and day out, and I will say all the time, day in and day out, to support families on this journey with their loved ones. Welcome, Cherie. Thank you so much for being here today.
Thank you so much for having me. I'm honored to be a part of this conversation.
Absolutely. So let's go in and let's start the conversation. So my first question is for you, Bryn. Tell me more about how this report came about, why you wanted this to happen, and has it been done in other countries? I would love to hear all about how and why.
Great. And I'd love to tell you and others, because I'm so excited about this report and finally getting it out there. This report is the first of its kind for the U.S., but it's not the first in the world. So what we did was a comprehensive economic and social analysis of the impact of eating disorders on the United States. What has been done before, led by the Butterfly Foundation in Australia more than 5 years ago, was a similar report for their nation in partnership with Deloitte Access Economics, an economic consulting firm that we worked with also. And then actually in the UK, BEAT also did a report like this, partnering with Pricewaterhouse. So it had been many years of these being out there, just been so impressive with their work. And I was hoping that someone would do it in the US, had not been done. Last year, I served my 1-year term as president of the Academy for Eating Disorders. I think it was my first day with the Academy for Eating Disorders when the executive director, Lisa Meyer, said, hey, we need to get this done for the US. And I said, all right, good. We got to figure it out, but we're going to do this. And we did, which led us to being able to put out this report here. And our goal for the report was to be able to put out what would be the most rigorous, most comprehensive economic report so that we could then take this to policymakers. And I know we're going to talk a lot about that today, is how we can use this report with policymakers to make a difference.
So if you don't mind just sharing a little bit about what this report found, and just so everybody who's watching knows, we're going to put links in the chat on how to download the key findings and also an actual link to the entire report, which I highly, highly suggest taking the time to read it, but even just perusing the infographic would be super helpful. So Bryn, do you want to share a little bit of the key findings? Was there anything that was surprising to you?
Yeah, yeah. So, the main key findings are not going to surprise anyone in the audience, but it was so important to get this down on paper with the numbers to be able to go further with this. This won't surprise anyone. Eating disorders are common. Eating disorders are deadly, and eating disorders are costly. What we found is that eating disorders will affect nearly 30 million Americans in their lifetime. And this is around 10% of the US population. 10% of the US population will have an eating disorder in their lifetime. Eating disorders affect all communities, people of all walks of life, no matter their gender, their sexual orientation, their race, ethnicity group, their body size, their age. Eating disorders affect everyone. Eating disorders are deadly and almost the most deadly mental health condition there is in the country right now. Eating disorders kill over 10,000 people in the US every single year. And these are deaths that are preventable. They are preventable. The condition is treatable. It doesn't have to be this way. Every 52 minutes, someone's loved one in the US dies of an eating disorder. And they are costly. And we know that the loved ones in the audience now, and the individuals affected by eating disorders know how costly they can be. What we did was add up the costs on individuals and on loved ones, on workplaces, to estimate the total cost in the US. And what our estimate is that each year the US economy loses 65 billion, and that's billion with a B, $65 billion per year because of eating disorders. And employers and policymakers really need to take note, because 3/4 of that cost to the economy every year, or about 50 billion, is because of effects on workplaces due to absenteeism or people missing work or not being able to perform their work because they're needing to care for loved ones, getting to treatment, and also, very sadly, because of premature death.
Mm-hmm.
All of these are having profound effect on the individuals and loved ones affected. But this report is about what is the effect on and the big picture for our economy and for employers. People are affected by eating disorders for the most part during their prime working years. Mm-hmm. And that's where the impact really escalates with eating disorders more than many other conditions that even may be more common. For individuals and loved ones, the estimates on how much the costs are to them is 24 billion a year, adding up all the ways that eating disorders are impacting individuals and loved ones in their own lives. And we know on average, loved ones will have to commit around even 6 weeks of time for unpaid work and care in what they call informal work. Mm-hmm. In economic terms, 6 weeks per year in caring for loved ones. And that's because our healthcare system is not doing its job. Prevention is not happening. Treatment access is not happening. And this is being borne by loved ones.
Thank you so much for a recap of the key findings. Bryn, I was so honored to have been asked to be part of the advisory committee for this study, and I have to share that the first time I read the report in its entirety, I was trying to escape my daughter for a moment, and so I hid in my closet, and I was reading it, and all I could do was cry. And it wasn't to what you shared. This is not new knowledge for us. We know the economic, we know the burden, we know the lives, and seeing it all written down for the first time did something to me personally where it cut me to my core, because I was grateful for the fact that we've come to a place where now we're going to be able to have these numbers to use in advocacy. But to just see the vast and great burden it has, not only in monetary, but just in lives, in time, in loss of productivity, loss of being loss to show up in school, to thrive, all of those. So I think that, for folks of lived experience like me, seeing these numbers almost validated a lot of my experience, my struggle. So I really want to thank, Strive to the Academy and Deloitte for just spending so much time doing this. I would be remiss to not, take it over to Cherie, because I know that, you are definitely someone of lived experience through your daughter, I would love to just hear like a little more how like this translates to you, to your experience, not only just monetarily, but just the toll it had not only on your daughter that had the eating disorder, but on you and on your husband and your other daughter. I would love to hear just more about that.
Joanna, I couldn't agree more. I mean, the burden carried by families is really immeasurable. And, this report is the beginning of quantifying what so many families and individuals have experienced, the significant cost of eating disorders financially, physically, and emotionally. And, my family literally personally experienced the crippling costs. And it was back in 2002, 2008, 2009, and my daughter was experiencing an eating disorder, and things got really bad really fast. And no medical professionals in my area were really educated about eating disorders. No one was providing me direction. And, Florida Blue pretty much told me, yeah, you're on your own. We don't cover eating disorders. And, so I was a mom. My daughter's decompensating. I'm terrified I'm going to lose her. I'm desperate for help. I found out about one program in Arizona that said, hey, it's a 90-day commitment and $180,000 upfront cash. And our country at that standpoint was in a financial crisis. So my husband was trying to figure out how to tell me, we don't have that money. Like, I can't give you the money you need to save her. And, somehow I found out about, FBT or family-based treatment. And I was like, okay, this is what I have to do because I have no other option. And my daughter is literally dying right in front of me. And it was the most terrifying and hardest thing I've ever done in my life. I owned my own business. I had 25 employees for whom I was responsible. They were the breadwinners of their family, so I just couldn't quit and shut down my business. These people were dependent on me, yet I had to save my daughter. And this is the dilemma that so many families are in. And I literally was spending 24/7 trying to give her the care she needs, nourishing her, and trying to continue to work to support all my employees. And I literally was killing myself to give my daughter the care she needed. And I ended up experiencing a cardiac event from the stress. It led to a 13-hour open heart surgery. I coded after the surgery. I was brought back to life. How it has paralyzed and impacted families and my family personally is difficult to put into words. I mean, we took second mortgages on our home. I have literally spent well into the six figures to cover treatment that insurance should have covered. I mean, they should have covered my daughter's eating disorder just like they covered my open heart surgery. And what insurance companies are doing is egregious. And this report is starting the conversation that eating disorders kill, they destroy families, and the burdens are really unimaginable of what families are experiencing.
Thank you, Cherie, for sharing that, for your vulnerability and your honesty. I think that, so many of us that are attending this live can absolutely relate to a lot of your parts of your story, and I think that for a lot of us, when you compared, like there wasn't even a question when you experienced your cardiac issue and the 13-hour heart surgery, or, loved ones of mine that are undergoing chemo for their cancer, there's not even a question. And yet that's why I'm so grateful for this report that turns around and says, this is how much we're spending because we are not doing early intervention, because we are not doing early education. Could you imagine if we were? Could we take a look at these burdens if we were actually funding immediate and early intervention, if we were arming our front care responders with the education to how to recognize and properly refer, if we did offer individuals the complete step down of care, treating to completion as opposed to let's just do that revolving door of treatment, which is why I too am so excited about this, to see this is the cost, and this is just in money and in time. What you shared is so far even bigger than that, is the toll that it's taken on livelihood, on families, on school, on business, so much. Bryn, I'm not sure if you want to share a little bit about like what Cherie has talked about, or I'm sure you've experienced many versions of Cherie's story as well, or heard of many versions of Cherie's stories as well.
Oh, yeah. And thank you, Cherie, for sharing that. Your story is what brings to life the numbers in this report. And that's something we're going to talk about a little bit later, about how to use a report. What I often tell my students in talking about any work like this, the research we do, is we want the data to inform the policy, so we know the policies that we put forward are evidence-based, but data never motivates lawmakers to act. It is you. It is your stories. The stories is what gets to the hearts of our lawmakers, and gives them the will to persevere, to put good policy forward, and to persevere through the struggles in any legislature to get this work done. Your stories are absolutely essential. And my role as a researcher is to help guide policy to be evidence-based, so we're hitting the right targets, we're fixing the right problems in the system there.
And we are so grateful for you, Bryn, because we need that research. We need those numbers. This is why I think advocacy has been such a huge part of my heart, my soul, my spirit, is being able to be in spaces with you, with the researchers, with the clinicians, because I think it's going to take all of us to come to the table with a unified voice and saying, this is the research, this is the treatment, and this is literally what you were just saying about Cherie, and this is what happens. This is what happens if we don't show up. This is what happens if we don't advocate. This is what happens if we don't use our voice. And as both Bryn and Cherie will tell you, anytime I can get on a little soapbox and talk about advocacy, I will. No doubt we'll do that. But Cherie, I wanted to just continue this conversation a little bit, because I know that access to care, the huge burden of eating disorders on cost and on time and on lives, is such a popular topic within, I know the mom to mom community, as well as each and every Wednesday evening when we have our friends and family group. Could you share a little bit about what you're hearing in these groups day in and day out? Because I do know that we do have some policymakers that are attending this live, as well as some clinicians, as well as researchers. So I would love to hear, is this something that is talked about a lot?
Oh, absolutely. I mean, the burden that families are carrying is devastating. I mean, oftentimes when families, begin on the journey of a loved one with an eating disorder, they don't realize how alone and how unsupported they're going to be. I mean, insurance companies are likely not going to cover treatment to outcome. Friends and families aren't going to be providing the support, love, and compassion that families receive when they have a loved one experiencing cancer. There's no respite care for carers of a loved one with an eating disorder. And on top of that, you're often being prescribed different methods of treatment by every professional you speak with. And it's incredibly isolating, lonely, confusing, and literally sucks the life right out of you. And your baby's life is literally dependent on you. And you're trying to figure out, how in the world am I going to financially cover this? And how am I going to remain vertical and keep breathing through this? And my baby's life is in my hands. And that is a terrifying place to be. And, one of the moms recently wrote this post, and I want to just read a little blurb. I can't help but feel so frustrated with the state of our medical mental health system and economic system. How do single parents do this? How do people who are not rich do this? I'm struggling to figure out how to get my daughter the best care possible, work a full-time job because I can't afford not to, keep my insurance that hopefully pays for it all, use up all of my paid time off to help, and not have some sort of a mental breakdown from the stress and burden of it all. My husband can't take the time off either. I don't mean to rant, but it seems so unfair that it is both difficult to care for my child both financially and emotionally. How do I continue to breathe? I mean, and that pretty much sums up what families are experiencing, and it has to change. And this report is a step to starting that conversation.
Thank you, Cherie, for sharing that and for allowing us to hear just, unfortunately, something that's posted a lot in these communities and something that we hear a lot. So literally on that, Bryn, what are the next steps? How can we use this report to help us create an impact or make a difference? And I would also love to know is, I know that you shared that Butterfly did it in Australia about 5 years ago. Did it create an impact? Did it have a change? So I would love to hear all about next steps.
Yeah. And I'll begin with your last question there, because it's so exciting what Butterfly has been able to do. So with their report, they commissioned it, they got it done, and they've been leveraging it in their work with policymakers. And they have made a huge step forward in terms of their impact just in the past year. So in November of 2019, the federal government in Australia announced that they are putting more than 110 million Australian dollars toward expanding eating disorders treatment. They're estimating it's in Australia, it's a smaller country than the US. They're estimating it's around 30,000 people each year who will now be able to access comprehensive eating disorders care that includes psychological care and nutrition care funded by their government, because they have national health insurance in Australia. And this is a commitment that Butterfly and the stakeholders working with researchers and many different community partners was able to secure with their national healthcare system just in the past year. Will make a tremendous difference in the lives of everyone there affected by an eating disorder and their loved ones there. Now, in the US, the community has been sounding the alarms, exactly like the story, the heartbreaking story you just read, Cherie, your own story. And just last night, I'm preparing to come on and do this interview with you. I got an email from a mother in my state of Massachusetts about exactly what you were saying. The insurers won't pay. She's being denied care for her child because the insurer just doesn't want to pay, even though it's absolutely medically essential. So this is happening in the US every day right now. And of course, advocates, community members have been saying this for years. But you know what we've heard from policymakers is they'll say, oh, well, we really need the numbers first before we're going to be able to take action. They've done, to their credit, they've done a little bit here and there, but it's piecemeal. And it is so far from inadequate when these stories are still happening every day. So what they've told us, they want the numbers. Well, now with our report, we can say they have the numbers. So whether our policymakers and other decision makers at health insurance and healthcare providers, whether they're moved by $65 billion hit on our economy every single year, or if they're moved by the life lost every 52 minutes, they have the numbers. Now it's time to act.
Bryn, yes, absolutely.
Absolutely.
Yes. I just want to take that piece and just share it everywhere. Cherie, what would you hope, what next steps would be, specifically from the mom community, our hopes of what the impact that it will have?
Absolutely. I mean, this report provides the hard data to start a conversation and to advocate, to gain awareness, to provide evidence of the need for research and to implement changes in policy that will save lives and hopefully prevent suffering. I mean, up to now, there hasn't even been a consensus on what the numbers were. And it's almost impossible to advocate for change when there's not even an agreement on the impact and cost to our society. So, this study is pivotal in uniting us to, lead change and awareness, citing the same numbers and statistics. And my hope is that this is the beginning, a beginning where we can use this data to gather more data and conduct more science. And, individuals and families deserve to be counted and to deserve to have their real struggles known. The loss financially, physically, emotionally, and the paralyzing impact on so many lives. And having these numbers is the beginning of that story. And I hope it's the platform that families' voices can start to be heard, the real suffering, the real burdens that they're carrying. It has to change.
1,000,000%. And we had a comment about, you would think 24 or so people a day should be enough. And absolutely, I think one person a day is too many, if you ask me. I think that, there's many of us that have spent, decades on using our voice. And, we've had some amazing friends along the way, policymakers. We've had some, I always enter a room and I'm very aware of who I represent. For every time I walk into a space, I represent, the 29 million Americans that are experiencing eating disorders around this country, as well as the hundreds of millions of loved ones that are supporting those 29 million. And I take that role very, very seriously. And I believe that conversations have been started. Having a report like this solidifies the necessary need for more research, more access to care, just more of everything. And something that I particularly very much connected with this study was, even that all races, however, people of color with eating disorders are half as likely to be diagnosed or to receive treatment. Something that's very important to me and that has been very much in line with our goals at the Alliance is educating our front care responders, our doctors, our nurses, our dentists on how to recognize and refer, and letting them know that eating disorders really do not discriminate between age, gender, race, class, body shape and size, sexual orientation. And so what I'm really excited about is going beyond this report too, and saying, what holes do we have? We need to be researching more about, like in the marginalized community. We need more research there. We need more research around binge eating disorder, around OSFED. So what's exciting to me is just what this means now and what it could mean in the future. So I not a question that we had planned, but just thinking 5 years from now, because we used the butterfly study as like saying, 5 years after. Bryn, what would you want to see in 5 years? If, of course, pie in the sky, what would you hope that this report does?
Oh, I'm so with you. This is exactly what I want to see 5 years from now. And I feel like we can do a lot of this to get this started. First, we need the federal government to step in, evaluate and correct the insurance coverage gaps. And this has come up a few times already in this conversation. Medicaid, Medicare, TRICARE, which is the military insurance, Indian Health Services, they all have gaps where people who are covered by this, many, many millions of people, are not able to access the comprehensive eating disorders care they need. That can be fixed. Government provides it. They can fix this. I want to see that in 5 years. I have a few more things I want, if I can go through my whole list.
Yeah,
right
sure.
now, the premier public health agency for the U.S., the Centers for Disease Control and Prevention, does no systematic monitoring of eating disorders in this country. They do it for many, many other conditions. They started doing it for autism spectrum disorders fully 20 years ago, systematic national monitoring of autism 20 years ago. They don't do anything for eating disorders that's systematic like that. We could follow the model, the wonderful model we've learned from the autism activism community, advocacy, what they put in place. We need to have national monitoring of eating disorders so we know the impact on communities. And so we know if we're seeing increases in cases or decreases in certain areas, and ideally also so we know the impact, a positive impact of prevention. We also need routine screening. And I know you mentioned that a few minutes ago, Johanna. Routine screening should be happening in every school, in primary care, especially with children and adolescents, but certainly through the lifespan. Eating disorders will continue on through the lifespan. It's not just a condition for children. And we need government and foundations to step up to invest in the research. Eating disorders are funded by NIH at about $1 per person affected by eating disorders, is well over $200 per person for a number of other major mental health conditions and physical health conditions. It's almost unfathomable how the disparities in funding could be that great. But now that it's exposed, it's something that we need to change. And it's not just an easy fix, but we know what to do. We've seen it done for other conditions. If I can just say one more word, Johanna, I'm so glad you brought up the issue of as really the social justice issue of how discrimination factors in here. With the COVID pandemic, Within several weeks, a month, we started seeing headline after headline about the gross racial disparities, really enormous racial disparities, and who's affected, who's able to access care, who's dying. These kinds of disparities that we're seeing in the headlines every day affect us around eating disorders too. There are barriers to mental health care that are particularly harsh for communities of color, for people living in low-income communities. And we know rates are higher for many groups marginalized by their identity. In sexual minority groups, gender minority groups, we see higher rates. Among boys and young men, we see boys of color have higher rates than white boys. We know these disparities are there. They are also affecting access to care. Where our report leaves off, and I want researchers to pick up here, and we need to do this work, whether it's from my program Striped at Harvard School of Public Health or my colleagues in research, we need to know how are structural racism and other structural oppressions driving these costs that we've now documented for eating disorders on our economy and on families, and how can they be addressed to lessen these costs? Who's getting left out of the meager care that's available now? And how do we bring a social justice lens to this work? That's what we've got to see next.
Bryn, yes, absolutely. I mean, that's very top of mind here at the Alliance. I know within the Eating Disorders Coalition, it's a conversation we've been having. I know Striped is doing a lot of wonderful work around that. And that's something that's really at the heart here of the Alliance, which is what prompted us to start our psychological services, where we offer very low cost outpatient care to individuals that are typically marginalized, but definitely underinsured or uninsured. Because we need to do better as a community. We need to do better. We need to show up more. Our policymakers need to make these changes. The payers need to be covering eating disorder care, because so many individuals are falling through the cracks. So Cherie, I would actually ask you the same question 5 years from now. What happened? So what do we do? What do we do? What does this do?
I hope this report compels action. There has to be action. I mean, we need our medical professionals to be educated on eating disorders. There has to be proper screening. There has to be prevention. Our society needs to understand that eating disorders are not a choice. No one looks out their window one morning and says, I think I'm gonna, start restricting or start binging. They have to understand, insurance companies have to be mandated to cover treatment to outcome. They have to, provide life-saving care and support to families. There has to be so much more research onto what evidence-based treatments, what they are. Where do we begin? Where's the best place to start? I mean, there are so many things that need to be done. The list is long, but my big thing is action. I mean, I've been coming to Washington, D.C., I think for 10, 11 years. And yes, I mean, now we're not walking into legislators' offices and having to educate them on what eating disorders are. I mean, they at least kind of understand what eating disorders are, but we really need action. Families need to, get the support to support their loved ones to full and complete recovery. And eating disorders are not a death sentence. They are treatable, and we have to start taking action. Yep. And families can no longer continue to carry this burden. My hope is that things change.
100%, Cherie. Thank you for that. There was a question that came in, and I this is definitely something that's very close to my heart. So, Bryn, I'm going to address it to you. I'm curious about the cost between the various eating disorders. Having worked in eating disorder treatment, I saw many of my clients with binge eating disorder be denied coverage due to insurance companies not understanding the severity of the illness, whereas many individuals with anorexia nervosa were regularly approved for extensions. There's this unfortunate hierarchy, if you will, within eating disorders. How can this report and further research promote greater equity in the care and access of services for individuals that are experiencing binge eating disorder or OSFED?
Yeah, okay. It's such an important issue. And what our report showed is that the cost for treatment on average with anorexia nervosa was higher but far fewer people have anorexia. Far more people have binge eating disorder or OSFED. So the total economic impact of binge eating disorder and OSFED actually is much larger than it is for anorexia nervosa when you talk about the whole country. So thinking about planning for how we cover the community affected by these, we need to be thinking about the big picture, and then also what's happening with individuals. The inequity of an insurer that you just described, of an insurer saying, oh, you just had the wrong eating disorder, we're not going to cover you, is absolutely outrageous. And that's why one of the first issues I said that government really needs to address with the public insurance systems is to make sure that all eating disorders are covered. Mm-hmm. And this is true for the private insurers too. Why are they cherry picking this eating disorder and not another? It's cruel. It's cruel that anyone would even think to do that. Mm-hmm. So we need to have the policies changed to make sure all eating disorders are covered. And then we also need to be planning, how are we reaching folks with different eating disorders, so that we're not just thinking if they don't walk through the door, it doesn't exist. We need to make sure we're going out into community and finding folks who need help around binge eating disorder, around OSFED, around other conditions that are not being met now.
Bryn, I think that was so spot on, and it's a conversation that I know I have in our individual groups, as well as we have it all the time in our friends and family groups, is, you know, really envisioning that mental health is completely on par with physical health. And I often wonder, you know, we would not cherry pick certain types of cancers over others, and that is exactly what's happening in our field. You know, as someone who did experience anorexia nervosa and then binge eating disorder, you know, I saw that I was not able to get care for my binge eating disorder. You know, I also knew that if it would have been 5 years earlier when I actually had reached out for care, I think that there would have been less hurdles for me to gain access. And I was literally left alone on my own to seek treatment, to find treatment, to piecemeal it. So it's definitely something that's very, very at the heart of for me personally, but definitely for the Alliance, is treating all eating disorders on par, because they're all equally as devastating, and they all have equally as many outcomes and side effects. So I very much appreciate that. And we've gotten so many comments from our amazing attendees about just this barrier of lack of access to care, specifically from individuals that are on Medicare, on Medicaid, that are on TRICARE, that just are not able to find care. And I just, this really actually brings me maybe to my last point, you know, is what can we do? Are there actual tangible action items that we can do now, today, July 15th, to start making an impact? So, Bryn, I would love for you to share more about what's going on the advocacy, on the policy side, that people can do right now.
Great question, because there's something everyone could do today, right now, this day, July 15th. The Eating Disorders Coalition and our many organization partners are organizing a push in Congress for the SERVE Act. The SERVE Act is designed to help fix unacceptable limits, exclusions in the coverage for service members and their dependents. Right now, if someone can sign up to serve in the military, serve their country, put their life on the line, but the government insurance for them will not save their child or their spouse if they develop an eating disorder. Only certain kinds of care are covered right now. That has to be fixed. The SERVE Act is in Congress. They're voting on it today or tomorrow, very soon. We want you to either pick up the phone or go by email, or even, I think, by Twitter. Go to the Eating Disorders Coalition site. I think it's going to be in the chat section for everyone in the audience to see this. Tell your member of Congress, support the SERVE Act. The SERVE Act will save lives. Support it today. We want to get this through Congress. So that's today. In the near term, we have the Nutrition Care Act, which is, again, designed to start to address these gaps in coverage. So Medicare covers some kinds of eating disorders care, but it puts a really harsh exclusion on nutrition care. Like, how do you treat eating disorders without the full range of experts that you need on a clinical team? You need nutritionists. The Nutrition Care Act is a major piece of legislation. The Eating Disorders Coalition and our many organization partners are working on this year. September 23rd, if I can jump ahead, 2 months, September 23rd, mark it in your calendar, virtual advocacy day in Congress with the Eating Disorders Coalition. I think you'll see information about how to sign up for that in the chat bar. Also, please join us. All the voices, the stories are what moves the lawmakers. We have the report to tell them which direction to go when they move, but they won't move without your story. So join us, please.
And I just have to echo how important your voice really is. And what I'm so excited about, even this year being virtual, I keep on trying to look for these silver linings of what this pandemic has given us, is the fact that, you know, for many of us, there are barriers to being able to get on a plane and to go to DC and to use your voice. But what this does is enables everybody from where they are to be able to participate in you know, Advocacy Day, in using your voice. And your voice matters. I cannot say that enough. I feel like many of us are very blasé and very much like, well, nothing's going to change. I'm not even going to show up anymore. And the point is that your voice really does matter. I have seen firsthand over the last 18 years of my life, of this past, of my existence, that my voice matters, your voice matters, all of our voices matter. And when we do use our voices together, we create a much louder, very more impactful message, and it works. So please take a moment to click on the phone to action link. Please reach out to your members of Congress today. Urge them to support the SERVE Act. Let's get individuals that are TRICARE recipients access to care if they're over the age of 20, which I don't even get me started about that age limitation. And then the importance of the Nutrition Cares Act, of, having folks that are on Medicare Part B get access to nutrition coverage. And the reason you might be thinking, why should I care about Medicare? I don't have Medicare. Medicare is really that gold standard. Like, once we get Medicare to pass it, then other insurances, other insurance to pass it. And then therefore we will require medical nutrition therapy in the treatment of eating disorders. Anybody can call. It doesn't matter. As long as you live in the zip code in which your member serves, your voice counts, your voice matters. I do want to just say, and yes, there was a question, do you have to be a voter? Can teens make calls and write letters? Yes, you have no
absolutely
idea how important, how much weight your kiddos' voices have. I mean, I've had the luxury of being able to advocate on the Hill with some amazing young kids and adolescents, and I will tell you, they didn't care what I had to say. They all know what they wanted to say. So please use this. If you are on the journey to recovery and you want to advocate and use your voice and show up, this is a beautiful way to do it, with just saying, you know what, this is what I'm going through. This is why I care about this issue. Please, please pay attention to this. It's more than just a bill that's coming across your desk. These are lives. These are representative of lives. And I just want to say, we got a message going back to the BED, distress, like the fact that medical providers and insurers are not at all taking BED on par with other eating disorders. Please note, the inequity care is absolutely rooted in fat phobia, as you shared, and it definitely shows blatant disregard. And we are doing everything in our power to shift. So help us use your voice. Bryn, any last comments for our audience?
Well, you summed it up so beautifully there. I just have to say the same points again. There is no time to waste. With someone's loved one passing away every 52 minutes, we have to be acting now. We've got the phone calls or emails we want to make today for the SERVE Act. Join us for the Eating Disorders Coalition Virtual Advocacy Day on the 23rd of September. And it's virtual, so you can stay home and do it. Download the handy fact sheet that we have. It's a one-page infographic. When you have time, you can read the 90-page report. But if you don't have time, you've got the one-pager there. That's what the lawmakers will have time to look at. Bring that to them, show them the data, and tell them your story, and we can make this change happen.
Thank you so much, Bryn.
Absolutely.
Cherie?
Yeah, families, I mean, we have to show up. We have to stand up. We have to share our stories. And these are simple things that we can do to create change. You know, reach out to your representatives today, share your story, you know, ask them to support the SERVE Act and then the Nutrition Care Act. Show up on Advocacy Day. You know, oftentimes, like you shared, families aren't afforded that opportunity because they're home saving their loved one's life, or they can't financially afford to do so. And with, you know, the current environment, this is an opportunity to have their voice serve. And nothing's going to change if we're not talking, if we're not sharing the stories, if we're not sharing the burdens. And I truly believe that we can make a difference. And I can't thank you enough for doing this for families, for individuals that are experiencing an eating disorder, something they never choose and never asked for. So thank you. And thank you for having this conversation.
Absolutely, Cherie. Thank you so much. And I really just want to reiterate that there's not just 2 times to use your voice. It's not just today and not on September 23rd, is that every day is an opportunity to use your voice. I've seen some unbelievable things happen from just one constituent picking up the phone, one constituent, you know, sending an email. So please do not hesitate to do it. The time is now. I would also just like to share for folks that are joining us that we have a myriad of services here at the Alliance that we just want you to know. All of our services are free and very, very low cost. We have our 2 weekly virtual support groups for individuals that are experiencing eating disorders, Monday evenings at 7:00 p.m. Eastern Standard Time and Saturday mornings at 11 a.m. Eastern Standard Time. And we have our friends and family, our loved one support groups on Wednesday evenings at 7:00 p.m. Eastern Standard Time. I really just want to share that, you know, right now, of course, the world is on its head, but please know that there are resources out there. There are organizations. We still move forward. We know that, you know, for many of us, this time has been even more triggering and even more difficult for individuals that are experiencing eating disorders, and for loved ones of those having to navigate uncharted territory, having their kids step down from a higher level of care and then having to continue the journey to recovery. So please know that the Alliance is here. It is here to help. We do have some amazing new groups coming down the pike. We are going to be starting an LGBTQIA plus specific virtual support group that is going to be clinician led, as well as a Spanish speaking group for individuals that have historically not had access, as well as in the near future a BIPOC group as well. We need to do better as a field, and we have committed as an organization to do better and to help in whichever way we can. So Bryn, Cherie, on behalf of the Alliance, thank you so much for showing up today, for all of your hard work. Thank you so much to the Academy for Eating Disorders, to Striped, to Deloitte for the hundreds and hundreds of hours that went into this. I cannot wait to see the impact that it'll make. And I'm just so grateful to just feel justified in my experience and in the work that we do. So thank you all so much. Have a wonderful rest of your day. Please take care. Thank you, guys.
Thank you, Johanna. Thank you, Cherie.
Thank you so much. Thank you. Thank you. Bye-bye.